there's a lot on the specifics that I can't say will happen in the next 10 years, but I can say that CGI will not remain the same.
Our special guests for today are Dr. Kara English, Chief Executive Officer and Chief Academic Officer of Cummings Graduate Institute, and Dr. Janet Cummings, Chair of the CGI Board of Directors and DBH faculty member. Welcome, Dr. English and Dr. Cummings.
Thank you,
Dr. Baldwin.
We are celebrating these 10 years of academic excellence at CGI, and I am so glad that we could conduct this podcast because it's a celebration.
Yeah.
Absolute celebration. So, and having the two of you on this podcast is very unique and special as being at the foundation of this great institution. So just a couple of questions that I have. Looking back at the past 10 years, how has Cummings Graduate Institute addressed the unmet educational need to prepare behavioral health providers?
Great question. Janet, you want to go first?
Sure. One thing that always has impressed me about CGI is that we listen to our students and our potential students. We envisioned this program as a cohort-based program, likely mostly in person with perhaps some online capability for more remote students. And potential students very quickly let us know that that was unacceptable and they wanted a fully online program. They didn't want a cohort program. They wanted to be able to go much more at their own pace, depending on their other responsibilities in life, and how they needed to pace themselves for that good old work-life balance. And so we listened and we reinvented entirely the program that we had envisioned. As we've gone along, we've continued to listen to our students, many of whom have as much or nearly as much job experience as a lot of the faculty, and are not 19-year-olds living in the dorm at mommy and daddy's expense anymore. These are intelligent, competent, professional people, and we listen to them. I'm very proud to say that CGI has never offered the same course twice. It may look the same in the catalog and it may have a very similar description, but it's not the same course. There are those surveys that students do at the end of each semester for each class that typically, in most universities go in the round file and aren't really looked at. At CGI, we read those very carefully and revamp each course before the next offering based on the feedback from our students who are also in the trenches in healthcare and know what they need. We've added courses on how to deal with veteran issues because the marketplace demands it. We listen to what's needed in the industry, both from our students and from others in the trenches in the healthcare industry, and we have evolved CGI accordingly. And we've been a work in progress for 10 years, and I'm sure we'll be a work in progress for the next 10 years.
That's absolutely true.
Absolutely true. We'll be here.
Yes.
So it's hard to add on to everything that Dr. Cummings mentioned, but this 10-year anniversary really has me reflecting on, some of the initial changes that we were kind of forced to make when we started CGI, because a lot of folks who haven't ever started a whole university from scratch before may not know. The various,
I can imagine. No, man.
Legal and accreditation requirements that, we needed to review and find a way to make CGI still be CGI without regressing to the mean, to use a Dr. Nick Cummings term, right?
Yeah.
So we always have really looked at ways to meet those kinds of requirements and still be different, still be disruptive, still be innovative. So I'm even thinking early days, Janet, I don't know if you recall this, but our accreditation body, when we started to move in that direction, kept telling us we needed to do a dissertation because it was required for doctoral students.
I remember that. Yeah.
And we said our students don't do dissertations. They do culminating projects. And it just sort of broke the mold for a doctoral program to be accredited through our accreditation body. But we explained it to them. We helped them understand why we do what we do and how important it is. And I think one of the things that's really surprised me the most is how the accreditation body has responded to CGI in a, wow, you're blowing our minds in a good way response. And to the extent that our accreditation expert at CGI, Amanda Harrison, is now one of the board of directors members at DEAC. So we are leading no matter where we go. And that opens doors for students who may not have had those openings to walk through before, because Amanda at the board of directors level is advocating for why we do things differently and how higher education needs to evolve to meet the needs, even mental needs of the workforce, not to mention our students. So there are just so many things that we do on a day-to-day basis to support our students, even just an example from yesterday in our team huddle where, we talked long about the recent natural disasters and apocalyptic conditions that students and faculty members and their communities are enduring right now and trying to deal with, and how we can, provide any amount of support that might actually be a help to them as they continue to navigate those challenges and try to be in a doctoral program at the same time and try to just take care of their normal work and family responsibilities. So I feel like our mission is very driven at healthcare, but we advance that mission through a lot of very personal ways. Like Dr. Cummings mentioned at the very beginning, we have always been focused and will always be focused on listening, to the primary people we want to serve, which is our students, and to their needs as they attempt to solve or support the needs in their communities. So we are very, very person-centered, student-centered in everything that we do.
Right. And as I'm hearing the stories of from start and the different innovative pieces of throughout the 10 years, all I'm hearing is impact on people and systems. And as we reflect back on those pivotal pieces of growth, what impact has this growth had on disrupting healthcare?
Our students are out there doing great things. Our graduates don't just get jobs.
Right.
They get amazing careers. And those take a bunch of different paths. For some, that is starting a healthcare delivery system and doing it right. For some, that is taking an existing network of healthcare centers and integrating them. For some, that is working on policy at a national level. But our students are out doing things that are important. They're not just, more mental health grads cranking out lousy services to a small handful of people, but they're innovating, and on their jobs and in their communities, they're doing it right, and therefore they're making an impact. They're also taking the training they received and training the people that they've hired. And sometimes that means in-service training, on-the-job supervision, and sometimes that means sending their employees to CGI to get their own Doctor of Behavioral Health degree. But our grads aren't just doing jobs, they're making a difference in whatever way and with whichever community they've chosen to do so.
Yeah, well said, Dr. Cummings. That is something that always, I think it's my favorite part about being involved in the culminating projects is getting to really work in depth on an individual basis with our students as they dream up what their launching pad is going to be. Their culminating project, launches them in the direction of their career. So as they're writing that culminating project, it is very much a evidence-based, as in they've reviewed all of the existing evidence, and they've also identified all the evidence that doesn't exist that still needs to be done, because we find that most of the time, and we tell our students that most of the time, your projects will not be well researched. So you're not going to find a ton of literature that you can just write a book on. You're going to have to innovate. You're going to have to write that literature. And that's what your CP starts doing. And then they combine that with the business plan. So just as a very recent example, one of our grads had a project that was focused on the infrastructure, as in buildings that are needed in a rural area in the United States, southwestern United States, because there just simply isn't a facility where substance use, medical detox, and counseling and inpatient care, followed by outpatient and community-based care, can be delivered in that rural area. And so this particular student, through the process of the culminating project, of course, and through the DBH program, had written a business plan and went to the local small business association to request support in looking for grants that could support building the infrastructure that is needed. And the director of that office attended this student's culminating project defense and spoke up about how strong the business plan was, and how normally when someone walks through their doors, they've never written a business plan. They don't have any of those pieces or even awareness of those pieces. So she said they usually spend a lot of their time teaching how to understand components of business, whereas this particular person walked through the door with a fully complete business plan, just needed help with the funding piece. And she said, I wish everybody would walk through the door like this. I've never seen such a prepared person ready for doing what they're trying to be doing. So the impact is obvious in a situation like that, because, you can have all the theories in the world, but unless you're prepared for the world of business and launching, funding, maintaining, overseeing, both clinical and operational and financial models, then you're not ready. But all of our graduates walk out of our doors ready to do that. So I think that's where I'm really proud, is that we've really maintained that focus on understanding the full spectrum of healthcare innovation through clinical, financial, and operational means, instead of just focusing on one of those areas.
Good deal. Thank you. As I say, about hearing you all and reflecting on these 10 years, so much accomplished. So much accomplished. So now that we have these 10 years down, packed here, the next question I have, what does the next 10 years look like?
It's easier to talk about the past than the future.
True.
Did in the last 10 years, and there are a lot of unknowns all over this world in the next 10 years. We don't know what the political balance of power in this country is going to look like after the next election. We don't know how that's going to affect healthcare. We've got large scale strikes happening. We've got skirmishes about to turn into wars in a lot of parts of the world. We face unknowns, maybe like we never have before. Certainly not in my lifetime. My dad, Nicholas Cummings, was in a lot of ways a prognosticator. He could tell you what was going to happen in 5 years, 10 years, 20 years in healthcare, and amazingly, he was right. I do not know how he did it. I do not have that skill myself, unfortunately. So there's a lot on the specifics that I can't say will happen in the next 10 years, but I can say that CGI will not remain the same. We will continue to innovate. We will continue to be disrupting healthcare, whatever that looks like in 5 to 10 years. And we will be adapting the education that we provide to our students to whatever happens in the next 5 to 10 years. And, we can think now about how some of that might look and maybe make some tentative plans, but the reality is all we can do is remain extremely flexible for the next years, exactly like we've done for the past 10 years. That day that Dr. English and I went in front of the board to get CGI licensed, and they absolutely grilled us. I was amazed. We got our license because they could not wrap their heads around our innovation. If you had asked us on that day what we'd look like in 10 years, I don't know what I might have said, but I would have been wrong. I could not have predicted at the time where we would be today. And I can't predict where we'll be exactly in 10 years, but we will be on the forefront of healthcare. I do know that.
Yeah, I completely agree with you, Dr. Cummings. I think we always have been and we always will be, just because that's the type of person that we attract. It doesn't matter whether you're a staff member, a faculty member, a student, everyone who comes to CGI comes to be a person with a voice instead of, sort of a tell me what to do and I'll do it. So, like you mentioned in your response to the first question, we are very student centered. We follow the interests of our students because they are needs in the community. And so from that perspective, there are some basic, population health needs that will always remain. But, we have really taken advanced steps to pursue health equity. And that is a very complex issue everywhere because healthcare and integrated care are inherently local to nod to the International Foundation of Integrated Care. They have often said that, and it doesn't matter where I am in the world, they're right. Because if healthcare is not serving the needs of the local community, with the nuances, geographies, languages, specific population health needs in that area, then it's not achieving its goals. So, we remain very focused on that idea first and foremost as our foundation. But as Dr. Cummings mentioned, we also are creating and developing new classes that are in alignment with what our students are asking for. Dr. Cummings, you did a suicidology class.
Right.
Based on student feedback. I developed a women's health class based on student feedback. I'm offering right now an independent study research class that may turn into a regularly offered course in partnership with the local community here that is, doing some innovative work and wants to measure the impact. And so there are opportunities, that will always be available.
Mm-hmm.
But there are also some unique challenges, like Dr. Cummings mentioned. Our population here in the U.S. as well as worldwide is facing some very unique climate-related disaster changes, the fires, the floods, the hurricanes, and what that means. So in, the United States right now, in the Midwest, we have people who are not able to get out of places where the roads and bridges have been completely washed away. And so you have people, I shared a video with you and Dr. Napier earlier this week of a person receiving insulin via drone.
Wow.
And so we have to really be using technologies in a way that help people rather than allowing technology to just run amok. So, AI is something that, artificial intelligence is something that we talk about all the time, both
all the time,
operationally, from an academic perspective. We talk with our students about the ethical, use of AI in clinical settings. So, technology will always advance us, and we will keep pace in a lot of ways, but also remain focused on, what are the tools available? How can we use them to the best of our ability of, our human brains, can conceive of, but also dream, like Dr. Cummings did. If there's not a degree program that meets these needs, we develop one. So we may see the development of new degree programs in our next 10 years. We developed the master's degree in healthcare leadership, and it didn't quite get off the ground because, frankly, it's ahead of its time. There aren't enough students at this time who are aware at the master's level or at the bachelor's level about healthcare leadership needs. And so, as we continue to look at the market, we may be too far ahead for there to be a significant enough market for us to fill a degree program. And so we may have to keep some of those things in our pocket for a while and try relaunching later.
Yes.
So, there are just so many things, as I think of all the things I've ever wanted to do just in the last 10 years, as well as things I have no awareness of at this time, but are definitely opportunities, because we are one of those very focused on opportunity universities. We will go for it if we want to go for it. If we feel, find a need and fill it is kind of one of our taglines, right?
Yes, it is.
In that sense,
find a need and filling it, people.
Yeah.
Right.
So.
Good deal. Good deal. Thank you for sharing that insight. And as I'm hearing all of the vision for the future, you definitely gave me insight of how the Institute will continue to educate integrated care professionals. Is there anything else that we can tag on to further explore that of how CGI will continue to educate integrated care professionals? Because I'm hearing there is some manuals, some new information coming out.
Yes. So Dr. Cummings and yourself, Dr. Baldwin, and I, and many of our faculty members and students are involved in writing what we are internally calling Biodyne 2.0, which is a follow-up to the publication Refocus Psychotherapy, which was published by Drs. Nick and Janet Cummings about 10 years ago. So it's a timely opportunity for us to say, boy, healthcare has changed a lot in the last 10 years.
Yes.
So it is time for new insights. It is time to be, writing what we have been learning in the last 10 years. So the three of us and many more at CGI are currently in the process of writing a book that will be published in 2025, and it will become the new textbook to replace or be supplementary with Refocus Psychotherapy.
Always moving forward, always moving forward. I appreciate your time today. 10 years. 10 years, amazing feat. Not every day that I get a chance to have a conversation with individuals who created an institution, an international institution, increasing the education of therapists, executive healthcare around the world. And so that's not an easy feat. So I just want to acknowledge that. I kind of plug sometimes at the English and like, when you're in the trenches and you're doing the work, and you see the accomplishments, it's like, for some of us, it's like, wow, that takes so much character, discipline, faith and belief and tenacity, which all characteristics of a DBH. But I just have to acknowledge that. It takes a lot of courage and spirit to do what you all have done. I'm glad to be a part of it, but at the foundation, I always recognize the architects. Mm-hmm. So just want, while we're here, and I want to give you flowers while you're living, as we say down south. Flowers while you're living.
Well, I owe everything to, my own education as a doctor of behavioral health. So I'm eternally grateful to Nick and Janet for advancing the Biodyne model as a doctoral program, because, everything that I learned in my own DBH studies has helped me launch into the ability to look at healthcare from an international perspective, to advance the model, to continue to meet the needs, to fill those unmet needs. And so I give my thanks to Janet and your family for laying the groundwork, having the vision, and then for some reason that I'm still unaware of, choosing me to lead us forward.
Well, you've done a great job leading us forward. So obviously we made the right choice.
And there's nothing like great leadership. And, thank you for everything that you're doing. And just, as we close this podcast, I mean, with these 10 years, you've helped people create careers, jobs, just opportunity after opportunity after opportunity. So anytime I see any DBHs, not just at CGI, but everywhere else, it started with the foundation belief with Nick Cummings. And, I've always tried to invoke his spirit in conversation somewhere, because that is, for me as a DBH, a young African-American male in rural North Carolina, looking at, what is my next steps, and to stumble across his information. I was like, wow, this is me. It spoke to me. I won't call it luck. It's divine intervention. And, my career has not been the same ever since I've came in connection with the name of Dr. Nick Cummings and Dr. Janet Cummings. Thank you so much. Thank you so much for the vision and belief. And we'll continue to do all that we can to make you proud.
You do make me proud, and I know you'll make me proud over the next 10 years as well.
Okay, I appreciate it. And I appreciate those words. I'm not going to cry on the podcast, okay? So, holding it in. Thank you. And thank you for joining us today and taking your time. And to our audience, 10 years we are celebrating, and we look forward to the next 10 years and beyond as CGI continues to be innovative in integrated healthcare, and we would love for you to be a part of the journey. Thank you for your time. Thank you for listening, and we will see you at our next podcast. This podcast is brought to you by Cummings Graduate Institute for Behavioral Health Studies. CGI is celebrating 10 years of disrupting behavioral healthcare education to improve the way the world experiences healthcare.